The overall goal of prehospital thrombolysis is to improve the outcome of acute ischemic stroke patients. The effects of thrombolysis are time-dependent. Every 15 minutes lost results in fewer patients being successfully treated. To reduce the delays between symptom onset and thrombolysis, a previously developed and validated algorithm is used by a dispatch center, a pre-hospital stroke team is trained, and a specialized ambulance, the STEMO, is equipped with a computed tomography scanner and point-of-care laboratory. Ultimately, this pre-hospital concept results in faster and more frequent thrombolysis of acute ischemic stroke patients, without increased risks.
The main advantage of pre-hospital thrombolysis compared to routine thrombolysis in hospitals is that this time-dependent treatment can be delivered earlier. This video shows the simulation of a stroke emergency responded to by a real pre-hospital stroke team using the STEMO, a specialized ambulance equipped with a CT scanner and a point-of-care laboratory.
An incoming medical emergency call presents as a stroke emergency. The dispatcher answers the call using diase and radios the alarm to STEMO. The STEMO emergency response team receives the alert, immediately grabs the fax containing the detailed information, and rushes to the STEMO vehicle. After the critical status of the patient is assessed, explore the patient's medical history. If a stroke is suspected, clinically assess the severity of the symptoms using the NIH stroke scale. Determine the exact onset of symptoms and ask for current medication with a focus on anticoagulation therapy. At the same time, measure and log the patient's vital signs, such as heart rate, blood pressure, blood sugar concentration, and oxygen saturation.